Good morning.
Good morning.
I am Belva Denmark Tibbs, and I'm a member of the African American Philanthropy Committee. Before we get started, I have a few housekeeping notes to share with you. We will have time at the end of our conversation for Q&A. If you're in the room, please wait for a microphone before asking your questions so everyone in the room and online can hear you. If you are joining us virtually, your camera is turned off and you are muted. However, we will be asking your questions via the Zoom chat feature. So please ask your question in the chat, and a volunteer in the room will work your question into the program. Finally, for a better viewing experience, I encourage you to change your Zoom view in the top right-hand corner of your screen to speaker view. Now, I would like to start off by having each panelist introduce themselves, and I'll start to my left.
Wonderful. Good morning, everyone.
Good morning.
My name is Michelle Hereford, and I am fortunate to serve as the System Chief Nurse Executive with University Hospital Health Systems. I am extremely fortunate to have a level of responsibility over the largest workforce within that health system to include nursing, not just nurses, environmental services, food and nutrition services, and I have a true passion around this work, so happy to be here. Thank you.
Good morning. I'm Vickie Johnson. Thank you. I'm Executive Vice President and Chief Community Officer for Cleveland Clinic. I've been in this role for 1 year. I've been with Cleveland Clinic for 10 years. Prior to that, I was the Executive Director of Fairfax Renaissance Development Corporation for 17 years, so I bring community to my work. Now that I'm at the executive level, I'm responsible for building the strategy to engage with every community in which we're located across our global footprint. Our goal is to work together to build healthy communities for everyone so that every member has an opportunity to live a healthy life. Thanks.
Hey, good morning, everybody. My name is Dr. Charles Modlin. I'm a practicing urologist. I'm actually the current Vice President and Chief Health Equity Officer at the MetroHealth Medical Center. I've been at MetroHealth for about 2.5 years. Prior to matriculating at MetroHealth, I was at Cleveland Clinic for 28 years as a practicing urologist, kidney transplant surgeon, and I've innovated a number of community outreach health equity programs. And one of my current objectives at MetroHealth is to look at the system as a whole to develop clinical community health equity programming. So I'm happy to be here on this panel today. Thank you.
Yay! So before we got started, I had shared with the panelists that, Dr. Modlin, whom I know very closely and have respect for, this is what I hear in the community all the time. He saved my life. Fortunately, on this panel, we have individuals who are not only passionate about saving lives, but they do it every day as part of their jobs. So we've got nursing, the physician side, as well as administration represented on this panel. I'm thrilled that we have our three big health systems represented on this panel. And as Dr. Erica Steed so aptly put, she kind of did our panel discussion, if you want, as she answered the questions about health and wealth. I wanted to give these experts an opportunity to answer this question. What is the intersectionality between health and wealth? And I'd like each one of you to answer that question.
Shall I begin?
Yes.
Wonderful. And so I'll answer it from this perspective, and I'll say a very non-scientific definition. It's as simple as, who we are from a race, social category perspective, and how that connects to our wealth and our health. So I'll elaborate even further. And you heard Dr. Erica Steed speak to this and speak to it quite well. When you live in a socioeconomic situation that does not support wealth, that does not have a wealthy outcome, it is extremely difficult to have a healthy outcome. And I'm sure as others will provide their definition as well, but as we spend some time today, I think what we will walk away with is why is that so? And not to move away from that why.
All right, thank you, Michelle. Vickie?
Sure. For me is, I think we've all seen the visual where you've seen these circles and then they overlap to some degree, and it's that space where they both overlap. That's what I think of, and I think that's what we can think of when we think about intersectionality. And we can also think about cause and effect and correlations for the reasons outcomes are as they are. And so that we should never look at anything in isolation, but how one influenced the other as we identify solutions is how I think about it.
Thank you. Dr. Modlin?
So, I mean, there's a direct correlation between your economic viability, your wealth status, and your overall health status. As a continuum, I would actually, we're talking about health and wealth. It's a two-way street. But I would actually, and Dr. Baston and Dr. Steed alluded to it and expanded upon this, I would put education leads to better wealth or economic stability, which leads to your better health outcomes for you, your family, and that is actually intergenerational. So we know that the higher levels of education you have, whether you're a high school dropout versus that you received a high school diploma or GED versus some college versus you're being a college graduate, at each one of those levels, your economic earning potential goes up, as does your health status. And that's been observed not only in Cleveland, but throughout other parts of the country. And in fact, it was noticed, some of the data, I think this is from a 2015 publication, so some of the data needs to be updated, but they said between 1970 and 2015, those living in the higher tax bracket, their life expectancy increased by 6 years. Those living in the lower income tax bracket, it only increased by 1.3 years. So there's a direct correlation. A lot of it relates to individuals who are better educated, possess a greater degree of health literacy, the ability to receive and understand important health information so that you'll better be able to interpret messages and, from your healthcare providers, understand how to take your medication, understand how to better care for yourself and your family. The more health literate you are, the better your health outcomes are going to be, the better earning potential that you have, the greater access you're going to have to health insurance, you're going to have job stability, you're going to have improved social connections and networking connections. So it's all related, but I would actually add to not just health and wealth, but I would put education in that continuum there as well.
Thank you, Dr. Modlin. Dr. Modlin is alluding to the social determinants of health. And as we discussed earlier in our previous session, only 20% of it, health, is really determined by what happens within the building. 80% of it are things that happen in the community. I'm going to skip to another question because I loved your answer, Dr. Modlin. I'm really going to go to Vickie, so get ready. Why is it that people come to Cleveland from all parts of the globe to receive care from the world's leading healthcare institutions, while at the same time the indigent neighbors of these same institutions are using their ERs for warming centers?
Sure. So I know this for a fact because I'm working on my dissertation on this topic, but over 2,000 nonprofit hospitals around the country are located in urban centers, in cities. And so it's not so much the healthcare system and what it does, it's where it's located and all the things that happen before, going all the way back to redlining, that creates situations that we have today. I think one of the speakers said this morning, we didn't cause any of this, and the big we. today, but there were systems put in place a very long time ago that we still grapple with today that leads to a situation where not only do neighbors use the ED, but they use any building. And Dr. Modlin knows this, that they can find. One, because they're safe, they're well lit, and again, they're located in the urban core, so it's easy to access them. And so what we're trying to do is change the need for that to happen through hire local, buy local, invest local. So again, those economic conditions and the ability to leverage Cleveland Clinic and Metro and UH as anchor institutions. So we're rooted in these communities. We're not going to leave. We can't leave. We're rooted. And so how do we leverage our purchasing power to buy local? We have $1.7 billion worth of construction underway at Cleveland Clinic. Metro has buildings under construction. So how do we intentionally hire diverse suppliers and building construction folks to be a part of that, so then now they can grow their business, they're more economically stable, they can feed more people, they can employ more people, and then people don't need to then come and use a ED to be warm. One quick story, this was a couple years ago, because not only they come to be cool as well. So I was doing my morning walk. I live in the neighborhood. I was walking down Chester very early because it wasn't hot yet. And there was a woman who was dressed in several layers of clothes and had bags. So that was a cue for me. And she was shaking on one of our gates for our substations. I mean, it's high voltage, not something you should do. So I immediately got on my phone and called the head of protective service. This is so true, y'all. And I'm walking on Chester. I'm heading toward the duck pond. And I said, we have a problem. There's a lady here. She's going to get hurt if we don't help her. And so I said, and be kind, be gentle, make sure she understands, that we're coming for help. And so I finished on my walk. I came back. She wasn't there. I went out to protective service again and actually looked for my phone. It was Gordon. And he had responded. He said, Vickie, we took care of the situation. We sent a couple of officers. They gave her money. They made sure she was transported well. They wanted to see if she was hungry. And this lady said, I was just trying to find a place to get out of the heat. And I took that message to the executive team and said, and for me it was biblical because it was early Sunday, and here's a woman, I just want to get out of the heat. And so I explained how we're more than a hospital. We're a place to come, to be warm, to be cool. And so now it's a part of our sustainability strategy. How can we identify locations within the Cleveland Clinic system? If we have an emergency, a disaster, all power goes out, where can people go to have electricity, to have warmth, and to be cool? So we have now integrated that into how we do business because we're much more than a healthcare system.
Yeah, let's stay on this. Are you doing the same thing at UH or at MetroHealth? Something to really look at your centers, your institutions, more as a community center than a hospital.
So I'll take that.
Go ahead, Michelle.
So absolutely. And actually,
we work together.
we work together and serve on a committee just to do exactly what she articulated. But I'd like to elaborate just a bit further from the perspective, Vickie mentioned be kind, be understanding, I'll say be relational. And often what you will find is there are many who will use our emergency rooms for warmth, for heat, or for cooling, for social interaction. You'll find some of that also occurs. People don't go to the emergency department just for fun. And internally to the cultures of all of our organizations, it's important that we articulate that this is not by choice, it's by necessity. Right?
Yeah.
And in addition to that, as we develop these centers, we develop different access points to care, it's important that the people who provide that care can truly relate and understand. And that's a harder road to hoe, if you ask me.
One thing I'll add, and I always call it Velasano. I mix the name of it because being at the clinic so long, I call it Velasano, but I'm going to call up on Ramona. We have the senior housing that we built. Viasano. So I have to get I have to get that straight. It's not the bike ride, but it's the yeah. But I'm not really sure how many residential facilities that houses, but Metro actually has taken on the responsibility of actually housing the senior populations, and I know there are more residential housing plans, in the pipeline. So you're right. We Vickie said we have to see ourselves more than just the purveyors of delivering health care. We actually have to look at the social determinants, which is actually housing insecurity, food insecurity, and so yeah, we have to look at the big picture.
All right. What is the role of philanthropy in closing the health equity gap? Anyone?
I can start.
Okay, thank you, Vickie.
So some of the work that we do as healthcare systems is funded through philanthropy. We have a philanthropy institute. We have board members that are very philanthropic, and they will fund full-time positions. They will fund initiatives. And so we use our resources that we earn and philanthropic dollars to do the work. I'm sure there are initiatives that the Cleveland Foundation has supported for us around the health education campus. So a lot of the work that you see that we're involved in is funded through philanthropy.
And to elaborate on that, and you may be asking why. Why will health systems perhaps not completely fund this? Why doesn't the federal government pay for health care? And you can continue to go on and on and on. There are not enough dollars. That's the best way to say it. There are not enough dollars. I would also elaborate from a true philanthropic perspective. It is wonderful in the city of Cleveland and in Northeast Ohio to see the level of engagement around giving. So I come here from Chicago, where I spent some time with Dr. Erica Steed as well, and we did not work together. I also was born and raised in Brooklyn, New York, and spent some additional time in Virginia. And I will share with you what I see here is none like what I've experienced in other locations.
Okay, tell us more.
Again, in working with Vickie and with others, the giving is just you ask and I'll say you receive, and that does not happen in other localities.
Okay, so just for a moment, let's do a shout out for Cleveland. Yeah. We really are a giving community. Okay, back to you. Sorry, Michelle.
Yes, ma'am.
I would like to add one more thing. I'm sorry.
No, go ahead. You go ahead.
No. To give a really concrete example, because you made me think of something. So one thing that we have that others, or to a greater extent than other industry, is jobs. I mean, we have 81,000 employees, 40,000 in Cleveland or Northeast Ohio. I'm not sure, but we are the largest employers. At the national level, healthcare are amongst the largest. So back to the question of philanthropy. So we have foundations who've contributed to internships for kids as young as middle school, who they're more shadowing experiences. So we have jobs, we have professionals. Back to Dale saying we need to be mentors and show kids early and often. So we're a perfect partner for philanthropy because we can provide the opportunity for the young person to come, experience all of the jobs in healthcare. We started an internship in 2015 for non-clinical positions. When I joined the clinic, so many African-American kids, because we're here, I'm going to talk about kids of color, we could not get them to apply for internships at Cleveland Clinic. Why? Because they said, I don't want to be a doctor. I said, oh my goodness, there's so many more positions. You know, you can be an attorney, you can be an accountant, you can be in marketing so many. In fact, there are fewer doctors in a healthcare system than so many other positions. So anyway, we married philanthropy and created opportunities for 100 Black and brown kids from Cleveland and East Cleveland to come to Cleveland Clinic and intern in law departments and marketing departments, accounting, engineering, you name it. So that's a really good example of how earlier today we heard we need to talk to each other and work with each other. You have a heart to give, you want to invest in young children, we have positions, and we have a workforce shortage. So we're mutually beneficial in that type of relationship, and that's how philanthropy can really be helpful.
And I have to do one more pitch, sorry. So, because she actually addressed all of you, and I know that all of you know people who, or children, or kids, who are looking for opportunities to work over the summer, to enter, or may not know exactly what they want to do for the rest of their lives, and that is fine. We have opportunities for them. That's an economic suggestion, intervention. So please, if you know someone, and I won't do the real commercial, like my name is Michelle Hereford, and you can call me at 804-855. I won't do that.
And actually, people were taking out their pens. They were getting ready or putting it on their phones, right.
I just wanted to say a bit about philanthropy. So a lot of times when we think about philanthropy, we think about just ones donating their financial resources to a charitable organization or for a cause or benefit. But actually, philanthropy includes donating one's skill sets, one's time to a cause, a benefit, a charity. We all have skill sets that we've learned, during our lived experiences through our educational attainment that we can give back to the younger generation and give back to one another. I mean, one example is this minority men's health fair, that we have now in its 20th year. I was supposed to give a commercial at the end, but
This worked. This is perfect timing.
but the reason I mention it is because that health fair is facilitated by the generosity and the philanthropic giving of 650 volunteers. When we did it at Cleveland Clinic and now at Metro. So I just want to remind everybody, philanthropy is not just giving one's economic resources, although that is essential and very important. The other thing is, it's important when we're talking about eradicating health disparities, addressing the health inequities that are pervasive, especially in Black and brown communities. It's important for the government, corporate world, the entire society to understand that this is a problem that we all have to wrap our hands around and come together to solve. Historically, it's been the belief that this is under the jurisdiction or purview of just the health systems, physicians. And by the way, I'm still trying to figure out what I want to do when I grow up, so I'll maybe apply for one of your internships, But the reason I say everybody, it's important that we solve this healthcare disparity situation is because we're actually living in a crisis state. A lot of times when we talk about health disparities, people believe that it's affecting or afflicting a small percentage of the population, minority populations, which it disproportionately afflicts. We have the highest morbidity and mortality resulting from health disparities, the lowest life expectancy in the Black community. In the next 10, 15 years or so, we are going to become the majority percentage of the population. So if we have more chronic disease, more infirmity, inability to work because of these chronic conditions, what's going to happen to the overall health and wellness of the economic vitality of the workforce, the entire nation, when minorities assume the majority percentage of the population? So this is a crisis situation that many don't know exists and needs to be looked at and solved by all sectors of society, not just left to be decided upon by the healthcare institutions.
Yeah, you talk about partnership, and I've heard several times, especially Vickie and Michelle, mentioning that they work together. Are there partnerships that are occurring within your health systems to put on programs like the Minority Men's Health Fair or other things? Can you talk about that?
Well, I see one individual, Nicole Ward. I'll ask her to stand up. And
Nicole Ward, would you please stand up?
Make them know your name. So this is and so the reason I single Nicole out is she has this wonderful organization that teaches individuals how to resuscitate individuals who have had a cardiac arrest. You can speak to that. But I mean, this is one example where we've been in partnership with Nicole for several of our men's events, our women's health fair events. Nicole actually has a personal story. What's your website?
The Make Them Know Your Name Foundation, so it's actually the initials, mtkyn.org.
Okay. And you have a personal, very emotional story to tell as to how you got into this work, but this is just one example where we can't do this alone. Our own individual health system can't do it alone, the clinic or UH. We rely on partnerships, organizations such as Nicole's that have come together to actually help educate and train the community around specific disease states. So that's just one example. We have other individuals in the room that we partner with as well.
Can we give a shout out to Nicole Ward, please? Because she also, this foundation also has an expo that is available. It's annual, correct? And it's all centered around health, and she makes that available to the community. And no, that was not on our script, but we are so glad to acknowledge that. This is also a testimony to the fact that you as individuals can do things and partner with systems to make things come to pass for our communities. They don't all the ideas don't have to come from the health systems. They actually can be generated from, the community, and you partner with a few people, and the next thing you know, you're filling up the Brown Stadium on an annual basis for our health expo. Thank you, Nicole. Anyone else? Oh, wait, before we do that, before we go to questions, any other comments that the panel would like to make about how you're partnering with others in the community to address health disparities and health equity?
So the short answer is yes. We heard earlier, and again, we cannot do this work alone. And one good example would be Lead Safe Cleveland Coalition, where there are over 400 partners that are making sure that Cleveland's children live in lead-safe homes. And Cleveland Clinic is a proud sponsor, committing $52.5 million to make sure that that happens. We know that the problem is in lead paint in the home. So if the home is lead-safe, regardless of who lives there, that the occupants will be safe as well. So that's an example. And one other thing everyone should know is that as nonprofit hospitals, every 3 years we conduct community health needs assessment. So we partner with our communities, the broad community, identify what the needs are with them. We decide together how to prioritize that. And then we produce an implementation plan, a strategic plan for doing that. 3 years later, we report to the IRS what we did to address the needs of the community shared with us. So it's designed in the whole strategy and obligation for being nonprofit. So yes, we do that. And our CEO and UH, we partner, we come together quarterly. And maybe 30, 40 of us are in the room. Every peer works together. So our head of research at Cleveland Clinic partners with the head of research at UH. The head of community at Cleveland Clinic, head of community at UH. Construction, building, design, all of that. We partnered 2 years ago to create a minority accelerator program where we identify 10 and then I think 5 minorities, small, female-owned businesses who don't know how to do business with a large institution, and they stay with us, and we help them learn how to bid for work, how to be certified as an MBE, and then at the end receive money to help them with their business, and then a contract to do business with Cleveland Clinic and/or UH. So that's just a few examples of how we partner around economic empowerment on the business side as well as the health of individuals.
And another aspect of economic empowerment, again, is education. So there's a lot of collaboration and partnerships with our academic institutions. You're all probably very familiar with, in addition to what I mentioned, very familiar with black men in white coats. And we bring a summit together every year to further help advance and grow minorities within the healthcare profession. So this goes beyond healthcare institutions, as you've heard, and others even within the community. We reach beyond in order to advance the health needed.
I'll just say, one example, and we have many other examples of community partners, is our partnership with the Cleveland Metropolitan School District. We actually have a school within our hospital. As far as we know, it's the only high school within a healthcare system, Lincoln West High School. I'm sure you've heard of Lincoln West High School. We have, about 60, how many students do we have? About 100 students, grades 9 through 12. Graduation rate is essentially 100%, and the majority, 92% of those individuals go on to college and graduate from college. The reason we partner with them is because, we've talked about pipeline initiatives to prepare the next generation to become healthcare providers. And we know that, what you see is what you'll be is the saying, but it's actually true because through this partnership and association, by having these kids within the four walls of our hospital, they get to shadow physicians, nurses, administrators on a daily basis. So that's very important. And also, we partner, as do each of the healthcare systems, with the faith-based community. Last Easter, Ernest Brown called me up and said, "You're going to church with me at the Word Church on Easter Sunday." He had me. He dragged me out there, but no, I mean, this is just one example, and we all do it. But it's very important because a lot of times, we can have certain strategies, but we can't implement those strategies or connect with the community in effective ways, or the most effective ways, unless we have surrogates. We have advocates, the ministers, the spiritual leaders, who are out there, encouraging their parishioners to take advantage of preventative health screening offerings and focus in on their health and that of their community. So that partnership is essential and critical with a faith-based community.
I love the fact that the health systems are partnering with faith-based institutions as well as different organizations within the community, foundations. But I want to go back to something that you were talking about in terms of actually creating a pipeline, an employment pipeline. You talked about the students. I think that is excellent. Back in the day when I was still working, that was something that is something that I enjoyed doing, and we worked with the Heights. And they actually came into our facilities, many of which are still MetroHealth today. I was formerly with Kaiser Permanente. But I want to talk about UH. Michelle, I'm going to put you on the spot. You've got an excellent training program for individuals who start in environmental services or food services, which are entry points into the healthcare institution. And you provide training and a variety of other things so those individuals can move up the ladder, career ladder, within the hospital. Can you talk about that a little bit more?
Sure. It's actually, I would say, one of those things that beyond warms your heart truly is impactful, and it has an economic impact overall. So our entry-level employees have the opportunity to take several paths, and they can actually climb what we call an environmental services ladder, a food and nutrition ladder. They can decide that they'd like to become a pharmacy tech. They can decide that they'd like to become an LPN and step your way into a registered nurse's position. We have medical assistants as well who take those same paths, and we call them earn to learn. So we actually provide full-time compensation so that our caregivers can work and go to school. Generally, it's a 4-day work week, and your 5th day is dedicated towards education. And you may not have class, you may have class, but you use that time to further study. We've been fortunate in a lot of ways. You may have read or heard about a grant which we received in collaboration with Kent State, which allowed us to actually train an additional 40 LPNs so that they can become registered nurses. Recently, we've had some, again, back to philanthropic support, to help us create a pipeline for nursing, the Future Nurses Academy. We're in our inaugural year. We had 26 students this year. In 3 separate locations, there are 78 students going through that program. So we're really excited about the things that not only create what I would call a pipeline in healthcare, but truly provide an opportunity to impact the economics of our communities.
Thank you. And that is an excellent program. I don't know, many of you, if you've had an opportunity to go to the hospital or be with I'm a caregiver, so I'm there, unfortunately, more frequently than I care to admit. But there's a shortage. Hospitals, institutions are experiencing a shortage of staff, a staffing shortage of nurses, a shortage of frontline employees. And there were probably issues prior to the pandemic, but they were exacerbated after the pandemic. So I want to kind of switch gears. We've been talking about systems. I do want to ask you this question. People say, if you know better, you do better. You've heard that. People are shaking their heads, but you've heard that before. Hasn't somebody said that in our community? So I'm going to ask the panelists, have you found that to be true? Okay, don't all speak at once.
I'm happy to take this one. My foot is shaking underneath the table a little bit. Because, there's two sides to this, right? If it were as simple as, if you know better, you do better, you would not have hypertension, you would not have obesity, people would stop smoking. It is not as simple as that. One of the things that we must realize, and I know all of us in this room do, but I would say others outside of this room perhaps may not. If you have to make a choice between keeping a roof over your head or buying vegetables that are extremely expensive, you make the choice. And that's not out of, I don't care about myself, I don't care about my body, I don't care about my children. It's out of the fact that I do care. And so what do we need to do, not only as healthcare providers or healthcare systems, I would even say as individuals, to ensure that food insecurities are not within our neighborhoods. And I have a quick story there because one of the things that, my husband and I do, and this is really a sidebar, is we love, in every state we have been in, we do love to rehab homes. And one of our dear dreams is to rehab homes in communities that look like us, specifically for seniors, so that our senior population can be cared for and live in a way that they want to live. They've dedicated their entire lives to everyone else. It's now time for us to dedicate our time for them. So the true sidebar here is we were in a community within Cleveland, and I happened to be hungry. So I wanted to pick up something to eat. I decided I'm not a fast food person. Unfortunately, everywhere I drove, there was nothing but fast food. I found one supermarket, and this saddens me. I walk in this supermarket, which, by the way, is gated. I call it gated, but everyone wants to make sure that no one steals a cart. I get that. But you get in, and I go to the produce section. There truly is no fresh produce. Truly. What I did see, I saw a line for, or a big liquor store embedded within that supermarket, and that saddens me. So I said to my husband, so what would happen if we as a group decided to buy this supermarket? Can we do something together to have a tremendous impact?
Yeah, food is medicine. You've heard that.
Yes.
It really is. And the lack of produce, fresh produce, healthy choices in our communities is staggering. And when you think about individuals who are living on fixed income or people who are poor, many times the best option is the $1 menu at the fast food place. And many times those things are not healthy. And, just on a personal note, I've decided once again to regain my health by eating healthy and cooking and doing all the things that we know we should do. So this is one thing where I always knew what I needed to do, but I wasn't doing it. But in order to do that, there are very limited options in many of the fast food places that are located within our communities. And I've tried that same thing, and I just said, a bottle of water, please. And maybe the salad wasn't as robust as I'm used to getting, but at least that was an option. Sometimes that's not even on the menu. So those are things that, yes, we can absolutely do something about. One is not to spend our dollars. Well, see, I already know some people. I was just going to say, I can hear my friends now say, what, you don't want to support, what I do, but to be moderate in terms of what we purchase, but also, as you said, make an investment to ensure that fresh produce is available in the community. And there are individuals who are doing community farms, just a variety of different things so people can have access. If you grow it, you will eat it.
So Belva, I will tell on myself though,
Okay.
because it's
So what did you do? You got the Big Mac?
my telling is I did not do anything about this situation. I bought a bag of potato chips. I'm serious.
It was
Sister.
It was a potato. It was a potato.
It was plain. But it does sadden me, and I'm challenging us in this room in all honesty. That's an example of something that we can do something about. We can.
And then just to that point, before others speak, there are opportunities to partner with organizations that are currently doing that in the community. They need resources. They need volunteers in many cases. They may even need land to continue to do what they do. So there are opportunities for us to partner.
So
Go
on
ahead.
that topic, one thing, please, I have to do this, since we're talking about commercials. Another role for a healthcare system is to leverage their purchasing power. I talked about that before, but the purchasing power of their caregivers as well. So you may have seen Meyer Fairfax Market open this year. That was,
Great.
it was 3 years in the making, but it turned into 5 because of COVID. And so Meyer is at East 105th and Cedar because we pledged our 20,000 caregivers would spend money there. And so I share that to say it really is about economics. Stores and retailers and businesses are not going to go where there's no population. That just doesn't make any sense. So what can we do? We can leverage how many cars we park. I mean, we told them how many cars we parked in our parking garages for visitors, for caregivers, how many times the shifts went over, the average income, the educational attainment, all that we provided to lure this business in because they have to make money. They have to. And we really went after the right partner with the right values and commitment to community, and that's why we selected Meyer to court them, and to get them in to do an urban store because they have superstores. So we're the second that they've done. The first was in Grand Rapids. We're the second one committed, but the third one that got completed. So they're in Detroit as well. So I share that story to say, we need you all to go and shop at East 105th and Cedar because we have to help our seniors who need that there so they can walk there. But the only way they're going to stay there is if we who have resources shop for the benefit of those who have less than we do. So in terms of our community, we need to do things and make decisions on how we invest our dollars with our own businesses and with businesses in our community who took a risk to come. And I'm asking you to please shop at East 105th and Cedar so that turns out to be a good business decision for them, so that they're there for generations, so that we do not have a food desert ever again at 105th and Cedar.
Okay, I love that strategy. You notice that this is very strategic. We are now engaging with all the individuals in this room and those people who are online. Just shop one time at 105th and Cedar. Let's start. Yes, I said it out loud. And here's why, because if we can do that, we gain momentum. And what is this event, this summit is all about? Momentum, a movement. A movement. It's not just one time, but I think if we start 105th and Cedar, shopping in our communities, it will make a difference. Did anyone else have anything?
Yeah, I'd like to expand upon what Vickie said because she's not telling you the whole story.
Please,
she's
tell us more and the rest of the story.
Well, and what I want to say is she's sitting here being very humble and modest because I was on the Cleveland Clinic Board of Governors for several years. And we had talked about bringing in a grocery store, and for several years there was no movement. And it wasn't until Vickie Johnson got involved, and with her stature in the Fairfax community, your previous position was executive director of Cleveland Renaissance, or the Fairfax Renaissance. So it was because she was able to, and a lot of that property was owned by African American community, members of the community. So it wasn't until she got involved and convinced, the community to move forward. So again, she's saying we, but actually it's really in large part because of her. I think in a lot of situations, what was the question? If you know more, you'll do more, or what was?
If you know better, you do.
If you know better, you'll do better.
Yes.
I think in many situations, I hold that from my experiences that I see some truth to that. I mean, not in every situation, obviously. But I say that as healthcare providers, it's our responsibility to, even though we're not necessarily going to see the impact of our interventions, it's important that we continue to educate our patients in the exam room when they're in front of us, and when we're out in the community about the importance of preventative health screenings, healthier lifestyles, pursuing an education. We may not know that they're listening to us. We may not know that they're going to take action based upon, our interventions and interactions with them. So I think in many situations, it does ring true. But I'll tell you, I had an epiphany after I read one book. And by the way, how many individuals have gotten my book and read my book? No, nobody raised their hands. That's, so anyway. But I'm gonna reference a book written by Chris Gardner. It's called Permission to Dream. Have you guys read that? I'm sure many of you have read. I would actually recommend that each one of you get that book, in addition to my book. But especially Chris Gardner, Permission to Dream. There was a movie with Will Smith in it Pursuit of Happiness, I think.
Yes.
But that book actually was an epiphany for me because it explains the continuous or vicious cycle that many young people find themselves in. Because once you read that book, it explains that a lot of the younger generation need us to tell them that they have permission to think big, to dream, and to aspire to achieve successes in their lives. And I would actually recommend, because it's actually a roadmap that all of us can follow. I can't tell you what effect that actually played upon me just reading that book. You can sit down and read that whole book in one day. But the younger generation actually looks to us for guidance and advice, and a lot of times we think that they're going to realize that they can achieve whatever we have achieved. If what they see is what they'll be, but not necessarily the case. You actually have to let them know that they are important, to us, to society. We care about them. In the situation of encouraging individuals to undergo preventative health screenings, take advantage of healthcare access opportunities, I think in order to build trusting relationships, they have to first understand that they mean that they're important, and it's our responsibility to let them know that we care about them. And once you can build that trusting relationship, any health care messages that we want to convey to them that they're going to be better received. So, but I would encourage people to get that book, Permission to Dream. It's really eye-opening for me.
Just
Yeah.
one piggyback on that, and
Yeah.
you know, I love what you said. You know, one of the things that's important, rather than or in addition to what we're talking about, is when people feel good, they'll do good. Right?
Yeah.
And we often don't talk about that, and that can connect to health and wealth and how they're treated, how we're treated. That is a key element of everything we're talking about. How do we make people feel? How do we treat them? When you walk into your physician's office, your nurse's office, sorry, Dr. Modlin, a little plug there. How do you feel? Do you see people that look like you and me and others? Can you have a conversation that may not be exactly the same as what some have learned in books? That's important.
As you talk about the importance of people feeling good and comfortable, it makes me think about culturally competent care. And so what, if anything, are your systems doing to ensure that the providers, the caregivers, are providing culturally competent care?
So I'll start. So we have several. I don't like to use the word interventions because I think that sounds so cold. There are several programs that exist within our organization, to include, of course, bias training. Recently, we've developed employee resource groups, or ERGs, and of which there are 6, which not only impact how our caregivers care for others, but impacts how we care for our caregivers. Again, too, when you feel good, you do good. There are numerous activities that occur within our organization to help individuals relate and understand beyond, and quite frankly, people that look like you and me, right? There are other patients as well that exist within our organizations that we too, as caregivers, need to know how to treat and care for them. So that's just one example.
Same for us. So I would add that with the Health Education Campus, which is a collaboration between Cleveland Clinic and Case Western Reserve for medical schools there, the current students are being trained that way, and they're being trained to interact with each other, nurses with doctors, because it's my understanding in previous generations, you were educated separately so that you didn't meet each other until you were at the patient bedside, which sounds really strange. But today, nursing, doctors, social workers, attorneys, dentists are all being trained together so that the patient is at the center and they can work on behalf, of that patient. So in addition to what Michelle shared, we're doing that as well to change the future of healthcare education.
So, at MetroHealth, you speak of cultural competency training, implicit biases training. At MetroHealth, we have about 9,000 caregivers. Every caregiver is required on an annual basis to take it's an online learning module with a post-test, assessment. But more than that, we actually have the employee-based resource groups that are required in person. So it's not just it's a interactive session so that we can assess the level of competency that individuals have. But the reason why that's often missed, the importance of cultural competency implicit biases training, is because you can't achieve health equity without that. I mean, it's a critical component because we know that the better culturally competent your healthcare provider is, the better the communication interaction between physician, patient, nurse, patient is going to be, and that's going to lead to better compliance and follow through on the part of the patient, leading to better health outcomes. So at MetroHealth, we put health equity at the top of the pyramid, and cultural competence implicit biases training is part of the in our toolkit so that we can achieve that.
Okay. Now, you in the audience have an opportunity to ask the panel questions. Please, are we going to have a mic for them, or they're just, oh, you have to come to the mic. So you're going to get your steps in. You're going to get your steps in. Please walk expeditiously to the mic. And then if there are any questions online for our those who are viewing virtually, please put your question in the chat, and someone will make sure that we work that into our program. Go right ahead.
I don't know if it's morning or afternoon. But hello.
Still morning. Still morning.
Deanna Davis. And my question.
Mic is
I'm
not
sorry,
on.
her mic is not on.
Hello.
Okay. Oh, you have to
Come
get
closer.
close to.
Sorry. Good morning, Deanna Davis. My question spins off of the last talk you just had on cultural competency. So with the rise of depression, anxiety, trauma, wanted to know, what are your systems providing for people who are identified and unidentified with those issues, in particular PTSD, depression, anxiety, trauma, complex trauma, betrayal, trauma, all those type of things. And then my second part is, with the November elections passing of the recreational marijuana, what are your concerns in educational classes that you're giving to the community about how marijuana affects your health and things like that?
Okay, thank you. Deanna has asked two questions. The first question has to do with how are systems addressing mental wellness, post-traumatic syndrome, depression, a variety of other things. As we emerged from the pandemic, people were finding that their mental wellness, their mental well-being was not where it should be. So that's the first question. And the second is about the passing or the legalizing of marijuana, and what are the institutions doing to educate the population about marijuana use? Who wants to take question one? Let's start with question one. Oh, you can sit down now. Thank
Okay,
you.
I'll start with one
Okay.
and leave two to the physicians and nurses. Okay. So to address mental health, behavioral health, depression, all of that, we're addressing it inside the hospital amongst our caregiver population, as well as the community. I'll comment on community. So at 79th and Quincy, we have our Community Health and Education Center, which is a place available to the community in the heart of the Fairfax neighborhood. And it's a place where we meet people where they are, all of the neighborhoods around main campus, and then guide them to the care they need. So we now have a psychiatrist who is at the center. She's available to talk with individuals as we screen for social determinants of health and people identify what their needs are. So that's one example. This professional leaving the hospital to come into the community where people are who aren't quite comfortable in asking for, exactly what they need in the hospital setting, but they will have a conversation in a community setting. In addition to that, how do we partner with others? There's a young man, Walter Patton, Ghetto Therapy, that's the name of his organization. We did not name it. People always take a reaction. I'm not saying that. That is his name. He is amazing, but isn't he amazing? And I know city council members are partnering with him, and we're working on the east side and the west side. He was at Lutheran Hospital last week. And this is a young man who brings young people together. Do you guys know him? Amazing, 200-300 individuals a night who will come to have an authentic, real, casual, personal conversation. It may be all kids one night, all men another, families. And so we're supporting him with money and a place to have meetings as a way of partnering with others to do this work. We can't do it, but we have resources to support those who have the ability to do it. So that's just a quick example. And a third, we had the U.S. Surgeon General come to town and speak to all of our physicians about how to care for patients, and particularly young people. We've seen an increase in mental health, behavioral health issues amongst the young for reasons that we all know, social media, isolation during COVID, and it's really showing up. Suicide rates are up, and we're trying to impact that the best that we can by partnering with others. And I know we do work together as a healthcare system as well.
Does anyone want to address the second part of the question, which was about educating the community on marijuana use now that it's legalized?
You know, I would be remiss, I'm going to punt that to Ramona, Brazil, Angela Vanoy. We have Natalie Harper here from Metro. No, but I'll be on record stating that I personally, I mean, not to get political, I personally was not in favor of the legalization of marijuana, although there are some additional benefits that I understand individuals with cancer, obviously chronic pain can benefit. As far as the behavioral health, MetroHealth, what was it, 2 years ago, we opened up the first behavioral health hospital that was established in the region over the past 50 years. So that, because we understand the importance of addressing mental health, it seems like it wasn't until the George Floyd situation that society became more aware of the importance of focusing in on mental and behavioral health. We do know that uncontrolled, untreated, ignored mental health actually can lead to physical manifestations of disease and vice versa. You know, chronic stress levels and we as a individual, you know, people of color, it's known that we suffer, you know, disproportionately from higher stress levels. We know that actually racism is a social determinant of health. That was just recently acknowledged by most you know, entities within the United States since the George Floyd situation. I would like to give a shout out to a Mr. Derek Jordan. He's an MBA. Recently, I think he came from Detroit, was it, or Minnesota? And the reason I point him out is he's the VP, Chief Administrator of our Behavioral Health Hospital in Cleveland Heights. So we want to show him a lot of support for the work that he's doing. So as far as the teaching of the marijuana, I actually put out a proposal. Ramona rejected it. We wanted to invite Snoop. Snoop to come and maybe educate the community about how the proper use of,
Different conference?
Yeah.
So are we going to hear from Ramona? Because I'm quite interested. I'm learning from this panel.
Well, okay. Well, shortly, we just took the mic over there. So Ramona afterwards, and then we have one more question in the room. Oh, wait, no, the gentleman behind you, Mr. Brown, right?
That
I'm
is
sorry,
correct.
he has the mic.
I don't have a question, I have a comment. First of all, I am just very proud to be in Cleveland where we have probably the best health care in the world, and to have just three outstanding individuals representative of that. I have to say this personally, I am not his public relationist at all, but Dr. Charles Modlin has been in the forefront of healthcare as it relates to minorities overall. And for years, he's been that way. When I come into a space like this, and I've been a part of the Philanthropy Summit since its inception, as being a part of the Cleveland Foundation, I know that often when we come into these spaces, we don't see people who look like us. And one of the comments that was made that there are a lot of young people who have never seen people in suits. Dr. Modlin definitely has been exemplary of that. When I was a patient of his, and I'm just, it'll be a year that I have had prostate cancer. I'm cancer-free at this point. And I will soon be 70 years old. But I am just absolutely grateful. And I say that because when you step into his office, it's not only what he can do with his hands and all of that, but it's also the compassion and the love that he has. And it's just absolutely very easy to speak your issues. So how you feel is important to how you heal.
Yes, amen.
Okay, thank you. Okay, so, you have a question? Okay.
You want to answer the education question?
quickly. And then this is what we've got. So that everyone knows, we're going to wrap up at about 10:55. I have some closing remarks. We've got one question in the chat. We have one question waiting here. So Ramona's going to give us a quick update on what MetroHealth is doing to educate people about marijuana.
So I'm going to lean on my nursing background.
But you have to stand.
Okay.
Thank you.
We haven't really changed our position about marijuana, even with the law changing. However, I think it's important that that is a conversation that's individualized with the provider. But it's also really important that for our young people, that they don't think that that's a license for them. We still want to stress that they have very young and developing brains, and that anything that you do that can alter that, that they should not do that. So even what may be happening in a society, that we still have to think about how that affects development.
Thank you. And then you're going to take the mic to her. And then while we're waiting, you want the question from the chat?
Yeah, so we have a question from our online audience. Are you open to working with community members who for decades have been preparing produce, acquiring land, building gardens and beds, and providing housing and repair? We're out here.
Oh.
I missed that.
Can you repeat the question?
I sure can. Are you open to working with community members who often for decades are accessing and preparing produce, acquiring land, building gardens and beds, providing housing and repair? We're out here. So how are the hospital systems pairing with community members who are trying to do the work?
Thank you.
This is Vickie Johnson from Cleveland Clinic. The short answer is yes. We've done that, and that person can feel free to reach out to me at johnSOV2@ccf.org.
Somebody could probably post that in the chat so they
And
can see it.
then definitely, like I said, we're already in the business of building housing for seniors and those with housing insecurity, and I'm sure they can reach out. Who would they reach out to at Metro? Ramona Brazil, and what
That would be
email?
Ramona Brazil
Brazil,
at MetroHealth.
And of course, UH has a response to this as well, and we are extremely interested in partnering with the community, definitely in the housing space. I would say to start with, you can reach out to me and I will direct this to the right individual, and it is Michelle, that's MICHELLE.Hereford, HEREFORD, at uhhospitals.org. I think I had the longest email.
No. And then, thank you. So the answer was yes. Thank you for the question in the chat. We have our two last questions for this. Go ahead, Candace.
Good morning. My name is Candace La Rochelle. What are all the health systems doing to expand access to primary care, especially in the areas that we serve? I was leaving church one day and driving my children home, and my son saw some parts of Cleveland Clinic, and he just said, he's 7, and he said, well, why does it look like this, and why do these houses look like that? And as a transplant from Cleveland, when I first moved here, and I work in healthcare, with all of the access that we have, the first thing people told me, Black people, when I moved here, was they're not here for us. So when we talk about access, what are we doing as the hospital systems to expand access to primary? And I say primary care especially because that's the front door, right? That's where it starts.
Absolutely. I'll start. And I know Vickie has the best answer here because of our work together. And I'll specifically talk about the Center for African American Health within University Hospitals Health System, which is led by Dr. Gregory Hall, by the way, who happens to be a primary care physician. And part of his strategy, or I should say our strategy, is to do exactly, I'm looking for where she went, to do it exactly what you mentioned, and that's part of it. The other aspect of access that I would like to make sure we maybe just spend 30 seconds talking about, sometimes it's not all the locations, it's being able to get in, being able to be received. So we're also expanding our days. We're making sure that our physicians and other providers are able to accept new appointments and follow up with older appointments, if you will. So I'll turn that over to Vickie. I know she was at the edge.
Well, so very similar, two ways, putting people in the community as well as increasing access of days. A good example is we have an African-American female who's a nurse practitioner that leads primary care, again, at 79th and Quincy, as a place that's in the heart of the neighborhood, which our main campus is in the Fairfax neighborhood. Also, a primary care physician out of Lutheran who's engaging with the Hispanic and Latino community and partnering with Neighborhood Family Practice. So we've talked about our partnership here. We also partner with Federal Qualified Health Centers.
So that's where I work.
Okay.
I was getting ready to
Okay.
say a shout out
Okay.
to neighborhood.
Yes, yeah. And because there's such a shortage, the strategy is, and you guys can do it better. So the Federal Qualified Health Center, maybe the partnership and the strategy is you provide primary care and we provide the specialty care and we work together and we care for the whole community collectively together. And Dominic Hobson and I have talked, and we're looking to do more of that, but that's a strategy that we've employed recently.
And I'll just say very quickly, MetroHealth is what we call a safety net hospital. Individuals can access MetroHealth regardless of their ability to pay. And as Vickie said, one of the objectives, initiatives, we're actually taking our services out to the community. We know it's difficult for them to get to us in many situations. We're building a health primary care center in Glenville. We actually just started a primary care clinic within the walls of the food bank. We're developing a primary and geriatric center actually at the Indian Hills residential housing. I think there's 3,000 residents in that area. So there are a number of things that we're doing. We have mobile vans for adults and children as well. So yeah, we definitely want to expand and let the community know that they can access our health system.
Thank you. These are going to be our two final questions, so take it away.
I'll try to be brief. So quickly, I have a recommendation, comment, and then a question, but I'm going to go real fast. So I applaud you for your programs that you have for children. I am a resource for children. I get text messages all the time about the different campaigns. And I'll just tell you real quickly, I volunteered in the pediatric NICU at UH when I was at Case. I've worked for Cleveland Clinic 3 times, stem cell research. I go, I leave, I go, I leave. And then when I was a paramedic many years ago, I've transported to Metro Hospital.
So which was your favorite?
So
Don't answer,
we know the
Leticia.
answer to
Don't
that
answer. Your question.
people know.
Your
Okay,
question.
so I just wanted to kind of give you that background. So although I'm not in healthcare, I'm very connected to the community just in terms of having rental property in the different areas. I used to be a former nutrition director where I met this young lady in a snowstorm showing up for education on nutrition and nobody showed up but us. So with that being said, for your programs, you guys are doing a great job with having the program, but the marketing pull-through is an opportunity. So marketing for those programs in places like food pantries at schools, and you may say, hey, this is the program. Can the guidance counselors or teachers share it? But I don't think the pull-through is getting there because people don't know about the programs. They don't know when to apply. Educating parents on why it's important. So even if they never had that experience, how do we do that connection with educating them and then removing the barriers, like getting them bus tickets to get there and so forth. And your programs may already do that, but making sure that that's well known. Okay.
Question.
Okay, yeah, and I did make my comment about you. So as it relates to culturally competent care, as a caregiver who has spent many times in these two systems, not your system, I have seen the ups and the downs, right? And I've been very public about that. I would like an opportunity, well, I'll just say, how are you measuring culturally competent care besides Press Ganey scores? Because as a caregiver, and I come in and they don't see me coming, right? So I've had really great experiences there. I'm just pointing, I'm not going to say. But as it relates to some of the hospital caregivers, they are very insensitive. And I know that there's a checklist on that care piece that they're supposed to do certain things, sit down with you, talk to you, and so forth. That an opportunity, and I'll just say what I think one should do is call everyone, right? So not just Black people, you got to call white people and so forth, but you want to make sure that you're checking, and Hispanic, Asian, checking on those experiences that the caregiver is getting while their person is in the hospital. Because again, I was in healthcare 20 years, so I can ask all the legal questions, medical questions. I did stem cell research, and then they're like, who are you?
Well-
When they're doing something wrong to my family member, not necessarily from the algorithm of treatment, but in terms of how they're talking to me.
What's your
So-
name again? I'm sorry.
My name is Letitia Knoll, and I'm Freedom Enterprise Foundation is my company.
Letitia Knoll has not only asked the question about
answered
how
it.
we're measuring culturally competent
gonna keep
care,
that
but answered the question on how you should measure culturally competent care.
That's what I was
So
gonna
we
say.
thank you.
If you need me, call me.
Yeah, and you have her contact.
But I know you have to
information.
go,
She will be here afterwards. I know this was the last. So thank you, Letitia.
And I know Belva needed me to get out the way.
Okay, so this is our final question. Okay, go ahead.
Hi, everyone. My name is Tila Patterson.
Hi, Tila.
Hi. I am the founder of Healing Spaces, which is an environmental justice initiative that addresses the root causes of social determinants of health and the effects of redlining. My question is simple. Is when do we start? Like, I'm one of those community members who is ready. I have clinical, I'm missing the clinical part. I have health and literacy programs that I reach out to the community and engage them. I produce media and film. And I also address environmental justice. So in our communities, I'm hosting a cleanup at Lakeview to address the air quality, for instance, to build that natural buffer there. So these are all the things that I currently do. It's just that sometimes, as we've all mentioned here today, it's that concerted effort of you all. So I would love to, as my person before me, speak to you all. I am ready to go. We have the plan. You all have the answers. I just want to know when we start.
Oh, I love that. So first,
Do
say
we have
your
the capital?
name, say your name and your company again.
Healing Spaces.
Healing Spaces and your name.
Tila Patterson.
Tila Patterson. So Tila Patterson of Healing Spaces is really offering to collaborate with these three institutions. Letitia Knoll is also offering to collaborate with the three institutions. And so what I would suggest is you two stay afterwards and talk with our panelists, because really this is about connecting. This is what we do at the African American Philanthropy Summit. So thank you very much. Connie Hill Johnson, I know did you just want to say goodbye? You're good? Because when the Cleveland Foundation board chair comes to the front, I know it's time. I want to thank you for your time and attention. We are the only thing standing between you and lunch. So at this point, I want to thank my panelists, those of you who viewed online. This has been an exciting conversation. Thank you.